My name's Ian McDermott. I'm an orthopaedic surgeon specialising purely in knees, based at London Sports Orthopaedics at 31 Old Broad Street in the middle of the City of London. Nearly all of my patients having knee replacement surgery have a patient-specific custom-made knee. I've been doing this surgery since 2012 and was the first surgeon in the UK to implant a conformist custom-made knee prosthesis. I firmly believe that it's by far the best prosthesis on the market. With a standard knee replacement, you have to cut the patient's bone to match the prosthesis, and the prosthesis will come in different sizes, A, B, C, D. If you're lucky enough to be in the middle of the A range, then great. But if you're halfway between an A and a B, you're going to get something that's either a bit too small or a bit too big. The other problem is that with knee replacements, they're all from one manufacturer, they will all come in one fixed shape. The reality is that people come in different shapes as well as different sizes. And there's huge variation between different people's knee anatomy. With a custom-made knee, we do a CT scan. The CT data goes to Conformis in Boston. They then need a 6-week window to design, manufacture and deliver the custom-made prosthesis back to us here in London. And then we can implant a knee that perfectly matches the patient's size, shapes and contours. Patients say that it feels more like a normal knee, they have better function and therefore patient satisfaction rates are much higher. The difference in cost is in the region of maybe £1,000 or so. A knee replacement, if you were self-funding, would cost you perhaps anything up to £15,000. A £1,000 difference on top of that is minimal if you consider the long-term benefits in terms of function, satisfaction and overall outcome. Custom-made knees are not readily available within the NHS, but we've been using custom-made knees here at London Sports Orthopaedics for the last 6 or 7 years, so we're doing large volumes. I've done over 200 conformist knees now, and the proof is actually in the outcomes, and our patients are living proof of that.
I had a knee replacement done with conformist knee, which was bespoke to my actual knee prior to surgery. It has fitted perfectly like a hand in a glove. Since the surgery, my life has been transformed. I can now go for 6-mile hikes in the countryside. I can now ride a bike again, which is fantastic, and I can actually face the escalators in the tube and walk down them with courage instead of fear. I'd never heard of a conformist knee. I had no idea that it had the possibilities to have a bespoke knee made. I have a much better range of movement than I have seen with people who have had, say, a general off-the-shelf knee replacement. My ability to move is fantastic. I can actually now dance. It's so nice to be able to just get up on that dance floor and not think twice.